How can I know if my injury has fully healed? And what can I do to speed up and complete my recovery? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes probably much like yourself so that you can stay healthy and perform your best. You know, there's so many injuries that active people suffer. It's sort of the nature of sports and exercise. And I don't say that to scare you off. We want more people playing sports and we want more people exercising. But yes, aches and pains and unfortunately some injuries happen. You know, it's the nature of being physically active, quite honestly. Most of those are minor. Most don't need surgery. But, you know, if you suffer an injury, obviously you want to get back to sports and exercise. So how can you do that quickly? And how can you do it safely so that you don't re-injure it and set yourself all the way back? Well, in today's Ask Dr. Geyer video, I answer that very question about an MCL injury of the knee. Okay, Pro How asks, I have a grade 2 MCL injury of my left knee that I suffered playing basketball. This is the second week of my treatment. I was doing rehab every day, trying to get my knee back in the game. When do I know if my knee has fully recovered, and what should I do to fully recover from the injury? Okay, before I answer Pro How's question, which is a great one, I appreciate that question, let me just briefly, in case you don't know, let me tell you what an MCL injury is of the knee. We actually think it's the most common acute injury of the knee, meaning a specific event occurred to cause the injury. This is the ligament on the inside of the knee, the side closest to the midline of your body. And it protects your knee against side-to-side stress, basically your ankle from going out to the outside in relation to the knee, where it would injure the ligament on the inside of the knee. The good thing is MCL injuries very, very, very commonly heal without surgery. Don't get me wrong, I love to operate, but I don't need to operate on you for an MCL injury. But you do have to take some steps to get that to heal. The first is you have to eliminate that side-to-side stress on the inside of your knee, so we usually put you in a brace that allows your knee to bend back and forth, but it eliminates that side-to-side motion, a hinged knee brace. Now you may only need that for a week or two if it's a mild injury. You may need that for 4 or 6 weeks if it's a more significant injury. So that's something that a doctor and a physical therapist can sort of help guide you in how long that's going to be. But that's the first thing you can do, is wear the brace that your healthcare provider has you wear so that the ligament heals the way it should. I think the other parts of it, though, somewhat are left up to biology. There's not that many ways that you can speed your body healing. Obviously, limiting stress that can slow healing is certainly a good thing. You know, doing activities in this case without wearing your brace, or potentially going back to sports too soon would be one of those. You know, but I think generally you're up to however quickly your body heals and makes new collagen, in this case, to heal the ligament. You're sort of at the mercy of how you heal. Yes, I know that there are injections, things like platelet-rich plasma, PRP, that in theory can speed healing, but that's sort of controversial. There's some research supporting it, some not. I think it's fine, I have no problem with it, but insurance doesn't pay for that, so you're paying out of pocket for something that should heal anyway. Pro athletes do it, I get that, but there's a lot more at stake, and you know, $250, $300, $400 injection to a professional team that's paying that athlete several $100,000 a week, you know, that may not be such a big deal, but it's worth talking to your doctor about. As far as what can help your recovery, we talked about what can help the ligament heal, but you're also going to want to, work on getting your knee motion back while it's healing. The brace will keep you from doing any bad stress to your knee while you get your knee motion back. You'll want to get your swelling down, so icing frequently can be helpful. You'll want to work on strengthening, and that's where I think really working with a physical therapist can be really beneficial. Yes, I know MCL injuries can heal on their own, but a physical therapist can help you get your strength and your motion back, to basically, so that when the ligament's healed, then you don't have to start all over getting motion and strength back. You'll already have that. Plus, they can guide you through a return to sports phase. They can work on landing with you. They can work on turning and cutting and pivoting like you would do in sports. They can work on that with you. Things like balance, things like neuromuscular control of your joint while you're landing and while you're turning. All that can be important so that you're 100% and ready to go when the ligament heals. You're ready to go and get back to your sport or your exercise. Have you suffered an MCL injury or maybe another knee injury and wondered what you could do to speed your healing and what you could do to return to sports and exercise quickly and safely? I would love to hear your experience. So below this video, tell me and the rest of the world about your injury and what you did to speed your healing. Did you do physical therapy? Did you wear a brace? Did you do other kinds of treatments? I'd love to hear it, and I bet other people all around the world would love to hear your experience because I bet they're going through something very similar. And if you know somebody that's had an MCL injury of the knee or really any injury and wondered about healing of that sports or exercise injury, please share this video with that person or multiple people so that we can help them decide, hey, what should I do to get back to 100% and get back in the game. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. There's a subscribe button in the upper right corner of this page. You can basically get these videos on ways to stay healthy and perform your best delivered directly to you. Thank you so much for watching. I really appreciate it. If you have a question about a sports or exercise injury that you would like me to answer, send it my way and I'll answer it in an upcoming Ask Dr. Geyer video. Remember to subscribe, and I look forward to seeing you right here next time.